Once hailed for its containment efforts of coronavirus, now faces a new challenge on its hand. On Saturday, Kerala reported over 14,000 cases with 108 fatalities, the highest amongst all the states. Kerala also continues to account for over 30% of India's daily COVID tally. Despite the heavy caseload, Kerala Chief Minister Pinarayi Vijayan downplayed the crisis, saying everything is under control and there is no need to worry. Our next report tells you more.
Kerala is once again facing a COVID crisis. On Saturday, the state registered 14,087 cases and 108 fatalities, the highest the country, contributing to over 30% of the active caseload in India. But CM Pinarayi Vijayan sought to allay fears amid the surge in cases.
കേരളത്തിൽ എന്തുകൊണ്ടാണ് രോഗികളുടെ എണ്ണത്തിൽ കുറവ് വരാത്തതെന്ന് പലരും ആശങ്കപ്പെടുന്നുണ്ട്. പൊതുജനാരോഗ്യ തത്വങ്ങളനുസരിച്ച് പരിശോധിച്ചാൽ ഇതിൽ അത്ഭുതപ്പെടേണ്ടതില്ല. അമിതമായി ഭയപ്പെടേണ്ടതില്ലെന്നും കാര്യങ്ങൾ നിയന്ത്രണത്തിലാണെന്നും ആത്മവിശ്വാസത്തോടെ നമുക്ക് പറയാൻ കഴിയും.
Kerala's Health Minister Veena George also showed confidence in the state's health infrastructure.
We have always tried to keep the positive cases below the medical capacity threshold, and also we have in Kerala more number of susceptible persons, so there are high chances that more people will be getting infected these days, but we are trying our best and our preventive measures are quite we have proved that our system is quite successful.
Despite these assurances, the reality on the ground is worrisome. Malappuram, Thrissur, Kozhikode, Ernakulam, Kollam and Palakkad remain the worst affected districts in Kerala, reporting over 1,000 cases in a day. Positivity rate is over 10% in the state, which means 10 out of 100 people who are getting tested for COVID-19 are turning out to be positive, while the average positivity rate of the country is over 2%.
The population of Kerala, you cannot compare with many other states, and you can call it a mini Dharavi. The entire Kerala can be called as a mini Dharavi, and we have very high population, and also the people traveling. The mobility of the people is very high. It's across the borders, and also inside the state. Also, the mobility of the people it's very high.
Once hailed for its containment efforts of coronavirus cases, Kerala has now a new challenge on its hands as the threat of a third wave looms large. With Gopi Krishnan Unnithan, Bureau Report, India Today.
Gopi Krishnan Unnithan now joins us for the latest. Gopi, the authorities need to work on a war footing given the fact that the cases are rising in Kerala. What are the authorities doing to bring the situation under control? In fact, yesterday we had reported some cases of Zika virus too. What is going on right there in Kerala?
Well, in Kerala, more specifically, the challenge at the moment is, in fact, the COVID-19 crisis, because the caseload has once again touched the 14,000 mark. But if you look at the data, overall data over the last 3-4 weeks, we can see that over a particular week, there are these slight fluctuations in caseloads, where during the beginning of the week, the caseload will actually be somewhere around 10,000 or below 10,000. Then as we get into the weekend, that is when the caseload will rise up a little, and then it would again fall down, is what the trend is showing. Now, this is actually a reflection of the ease in lockdown restrictions, because after these lockdown restrictions were eased across the state, people have started moving out, and considering the fact that Kerala is a state with very high population density, it is also very difficult for the state administration to keep these people closed indoors, because already there was a first lockdown during the first wave. Then during the second wave of the pandemic, Kerala had again imposed a lockdown. And now the government, what we understand at the moment, is trying to maintain a balance between life and livelihood. But the challenge, in fact, remains that cases are more or less higher, because a daily caseload of 13,000 or 14,000 or even 12,000 is not something that we can actually be breathing easy. But Chief Minister, however, says that the situation is under control because he is pointing at the state's health infrastructure. Even at a point when the state had about 40,000 cases on a daily basis, the ICU beds or the hospital beds were never overflowing, or the capacity was never really at point. So considering that, or comparing the situation with that point, Kerala is still saying that they may be able to manage this crisis. But one thing that needs to be looked upon at a priority basis is to bring down the cases and bring down the test positivity.
All right, leave it at that, Gopi. Thanks for joining us with the latest details right there on the Kerala COVID surge. Even as cases are spiking in Kerala, Sabarimala temple is going to be opening up for devotees for monthly puja. And the famous Ayyappa temple, Sabarimala, is all set to welcome devotees, but with strict protocols in place. The temple will open from 17th to 21st July, and a maximum of 5,000 devotees will be allowed through an online booking system. The Kerala government announced a set of rules for the entry. Only devotees who are fully vaccinated are going to be allowed. Devotees will have to carry a negative RT-PCR test issued within 72 hours. The announcement is coming in as Kerala is witnessing a massive surge in the cases, recording over 10,000 daily cases for the past few weeks.